Thank you so much. I'm really grateful that this panel was included as part of your discussions. I think there's so much to learn from Native American communities about how to prevent suicide. So just some quick background. Key points, I'm going to show some busy slides, but here are the key points. There's very incomplete epidata on serious mental illness among Native Americans. Huge regional differences in serious mental illness and suicide, although rates of suicide are much higher among American Indians compared to other populations in the United States. There's a lack of and poor access to mental health services, big cultural differences in terms of understanding mental illness and mental health promotion. And I think some of the traditions really speak to the social determinants and strengths that can be brought to bear on suicide prevention. Big differences in patterns of suicide that my colleague Jim Allen will go into more, but a much younger population is affected by suicide. And I think because of that, we have a lot to learn as across the globe right now we're seeing increases in teenage and young adult suicide, and the reference to the veterans, the 18 to 34-year-olds that have the highest rates. So what can we learn from these communities? And alternative strategies are needed. So the IHS, the Indian Health Service, is responsible to providing medical and mental health services for approximately 2 million American Indian Alaskan Native people. There are at least 3 to 4 million other American Indians and Alaska Natives who are living in urban areas that aren't covered by IHS, might be covered by Medicare and Medicaid. Historical trauma, forced relocation, cultural assimilation, broken treaties, this huge constellation of social justice issues continues to affect very high behavioral mental health disparities for American Indian and Alaska Natives. The suicide rate among American Indians and Alaska Natives, like everybody else, has been increasing since 2003. In the 18 states that participated in the National Violent Death Reporting System, which others have referred to, there are about 3.5 times higher rates than those among the other racial and ethnic groups. And you see that rate there is very much like the military data that we just saw. Suicide is the second leading cause of death behind unintentional injuries for American Indian youth ages 15 to 24. So think of the years of productive life lost for those communities. It's astounding. They also experience higher rates of serious psychological problems. The most significant mental health concerns are anxiety, depression, substance use, PTSD, which is about 4 times higher, and suicide. Historical traumas, effects on serious mental illness are unknown. So this is too hard to read. I'm so sorry, but basically, if you could see, this is lifetime prevalence rates of different serious mental illness, and I just wanted to highlight at the bottom. The left side is male and the right side is female, and American Indian, both genders have higher PTSD and anxiety. Men have many times higher rates of alcohol dependence, and women higher depression rates. There are also huge problems with unmet need in terms of the amount of mental illness and the numbers of people who are getting care. So again, I apologize for these very small data sets, but at least you can kind of get the picture that there are at least 7 times the unmet need in some Native populations for certain illnesses. And this is just some data from a study on parents. So American Indian and Alaskan Native parents have higher rates of serious mental illness, and we like to think about like intergenerational prevention and intergenerational needs. And I think when you think about historical trauma compounded by intergenerational transmission of serious mental illness, we have a huge problem in tribal communities. There's a great shortage of providers, so there are very few qualified treatment providers, especially for children and adolescents who need it most in tribal communities. In some regions, there are none. There are no psychiatrists or psychologists or social workers in some regions where Indian Health Service is taking care of tribal community members. The providers often become overwhelmed by the continuous demand for services, so there are huge vacancy rates as well, about 38% in those positions that are funded by Indian Health Service. So this just gives you some background, and we'll leap into what can be done in the context of what I just showed. So I think Jim's up next.
Thank you, Allison.